Quite a few years ago, I lost my sister. The doctors were trying to treat her with cirrhosis of the liver for years. Down towards the end, they had a specialist come out from Toronto, and he diagnosed this specific liver disease that was striking First Nations women.
I'm a Hmong woman, a WI壱KINEM woman from the coast, and this very much affects my family.
In regards to your sister's situation and the situation of many of the Indigenous community, there are two diseases which are autoimmune in nature. There are two in particular. One is primary biliary cholangitis. The other is a related disease called autoimmune hepatitis. Both diseases, if diagnosed early, well before there's liver failure from cirrhosis, can rectify the situation, help patients prolong their lives, and even in some cases cause reversal of the process.
Well, it was heartbreaking for us to lose her, but more heartbreaking to know that she didn't have to die.
Both autoimmune hepatitis and primary biliary cholangitis are predominantly diseases that affect women.
Yeah, I have one aunt that was diagnosed properly, so she was one of the lucky ones. When that specialist came out from Toronto, he said that I've found this amongst many of the First Nations women on the coast. We were spent years going from doctor to doctor with my sister, and they were unable to find the cause.
In the 1990s and 1980s, and maybe even into the 2000s, most doctors really didn't know much about liver disease at all. Well, I mean, whatever they learned maybe was a stereotype of alcohol causes all liver diseases, or some erroneous kind of stuff. I think it was probably just ignorance.
People should look deeper, not assume that everything is related to alcoholism. More of this knowledge needs to be put into the healthcare system.
Before 2000, it really wasn't known that the Indigenous community of British Columbia had a lot of autoimmune liver disease. I started looking at this and publishing some papers, and suddenly people started to realize that this was actually true.
Kind of half of our battle is trying to bring back our traditional foods. We were known as the saltwater people and primarily lived off of the sea. We are really trying to encourage going back to seafood.
I strongly agree with that. A seafood diet is actually probably the best.
The other thing is the environmental effects. Ecosystems is degrading, and seafood is becoming more scarce.
The ecosystem is ultimately our health system, and protecting our rights as Hmong to the places we belong to and to the food sources that are there that are what kept us sustained over, as we know, but also shared through archaeology now, generations upon generations, thousands to tens of thousands of years.
I just wonder what could be improved with our healthcare system to stop these things from happening or prevent them. It's still a relatively unknown thing amongst our people, the First Nations people, and it feels like it amongst the medical community too.
So one of the things that drew me to this realm of medicine is that it really looks further upstream. A lot of things that I learned about in Western medical school were kind of band-aid approaches to things that were arising.
There was many things I was seeing with community members where there was just very few things I could do as a family physician to help keep us well in the first place.
There's things we can do through medicine that I learned in medical school to help remedy that, but really the upstream of that is the access to our traditional food sources, to our territories, to the things that we were in relationship with, which helped to keep us well, and herring being a keystone species, a foundation of so much in the web of life, our relatives, the food within the ocean that we're learning about here today. If we don't have those, our relatives herring able to return to the places where they spawned, that impacts all things throughout the web, including our health and the access to the bodies that herring supply us with to help keep our bodies well as well.